Everyone, thank you for joining us for this COVID-19 update and vaccine update with Dr. Cara Christ. There will be a presentation and then you're welcome to ask questions. Please raise your hand in Zoom to ask questions. We do have a stop at 2 o'clock. So thank you for joining us, Dr. Christ. Take it away.
Thanks, Steve, and good afternoon, everybody. Thank you for joining us today on this Friday afternoon. For those who don't know me, I am Dr. Cara Christ. I'm the director of the Arizona Department of Health Services. I'm going to use a similar format this week that we've used in previous weeks. I'll go through a little bit of data, some updates on vaccine distribution, and I'll leave time for questions and answers at the end. So hopefully you're all familiar with this. Is the number of cases by week with a 7-day moving average. You can see that for the past several weeks, our cases have been trending down. This is a really good sign and mirrors a lot of our other data, including our hospital usage data and our percent positivity. Again, this is our epidemiologic curve, or our EPI curve, where we show cases by day. This is by the date that the specimen was collected, which we feel is the date closest to when somebody was likely feeling ill or was ill. And then you can see the mitigation strategies and different events that have played a role in Arizona's COVID-19 pandemic. Those mitigation strategies that are in red are those that are still in place in Arizona. And we've also overlaid the vaccination phases so that we can see the progress as we continue to move through the pandemic. This is our percent positivity. This one's a little bit different than what's on the front page of our laboratory testing page on our dashboard. This is the percent positivity using total tests performed. So on our summary page and on the front page, you'll see it in unique Arizonans. The unique Arizonans are represented by the dark gray bars. That is each Arizonan who's had a first test or only one test, or once they've become positive, the date of their positive test. As you look at the lighter gray bars, those are repeat tests. So you can see that almost 50% of our tests lately are done in individuals in Arizona that have already had a positive test. But you can see that our percent positivity has been decreasing over the last several weeks. And is currently at a 6.3% for the current week that we're in. We always anticipate that to continue to change up through Monday or Tuesday of next week, given the lab reporting turnaround times. And very excited about this graph. So this graph is taken out of our weekly infographic that gets posted, but you can see that almost all counties are in a downward trend with cases over the last 5 weeks. We do have 2 that we feel are just kind of staying moderate, but you can still see that there is a significant slope downward on those, and that is Coconino and Greenlee. But the state is moving in the right direction with our cases. And so now I'm going to move into vaccine updates and the implementation. We are currently still in, for the most part throughout the state, our prioritized 1B phase. That includes workers from the 1A, including our healthcare providers and healthcare support occupations, our emergency medical services workers, as well as those staff that work in a long-term care facility and their residents. When you move into 1B, we are also in the prioritized phase, including education and childcare workers, as well as protective services occupations, including our law enforcement, correctional officers, child safety services, and then adults age 65 and older. As we move into, some of our counties are moving into the next phase. We do have rural counties that have moved into 1B and even 1C populations based on the number of individuals that they have vaccinated and the demand for the vaccine. These recommendations are consistent with the Centers for Disease Control and Prevention's recommendations for vaccine prioritization, and were recommended by the Arizona Vaccine and Antiviral Prioritization Advisory Committee. So we continue to update this on our website, which is azhealth.gov/findvaccine. And we also put up an infographic so that individuals can identify if what phase their county is currently in addition to whether or not they are currently vaccinating age 65 and over. 14 of our 15 counties are currently vaccinating people over 65 and older. And as of today, almost 1.4 million doses have been administered in Arizona, with over 1 million unique Arizonans receiving at least the first dose. And again, for those that have not been with us before, just to remind everybody that Arizona follows now a state-directed local allocator model. So we work with our county health departments. They're the boots on the ground and the experts in their community. As we get our weekly allocation numbers, we divide that up on a pro rata population basis to each county based on the percent of the population that they hold for this as part of the state of the phase that we're in. So we are currently using the 1B phase population to determine that. They get allocated a certain number of doses. They tell us how they want and where they want those doses to go. Those doses then the providers come back to us with the number of doses each provider is going to get. We place that order with CDC, and then CDC has the manufacturers directly ship the vaccine to the partners who will be vaccinating. For this week has caused some issues with the weather that the country is currently experiencing. And so we are still determining the allocations for next week because we've had to do some moving around of doses around the state to try to keep as many appointments that had been filled open as possible. So we will have those numbers updated in our infographic that will go live Monday. But you can see that we have gotten pretty steady vaccine over the last couple of weeks. We anticipate that to continue. We are hearing that there will be a small bump in the Pfizer. Part of that will have to do with them counting that sixth dose that pharmacies and providers are routinely able to get out of that Pfizer vaccine. But there will be an increase both to the pharmacy retail program. CVS, starting next week, will have doses of Pfizer available at very select stores nationwide, as well as a little bit of extra Pfizer that is coming to the state. This is the doses allocated to each county. This is for the week of February 14th. We will update this on Monday, but you can see this chart shows the number of new doses that were allocated for both Pfizer and Moderna to each county, as well as the total doses allocated for Pfizer, Moderna, and then the total allocated. We're still waiting for the notice that our Moderna doses have shipped. We did receive notice, and several providers have already received the Pfizer doses for this week. What we are being told from our federal partners is if a provider who is waiting for Moderna has not received that notification that they will receive that on Saturday, it likely will ship out at the beginning of the week with next week's doses. So we continue to work with our local and federal partners to keep tabs on where that vaccine is and when we believe that will arrive in this state. We continue to outpace the state's weekly allocation. So the week of February 2nd, we did almost 300,000 doses that week. We did put in that federal request for additional doses. That has not been fulfilled just yet, but Arizona is doing, we're doing between 90 and 95% of our doses utilized this week, which is a significant improvement. We have had over 500 providers statewide receive vaccine, and that includes county health departments, hospitals, FQHCs, pharmacies, and other providers that are assisting with the vaccination efforts. And we continue to work to get our long-term care facilities vaccinated because we know that that is a priority. And almost 64,000 shots have been administered in those facilities. We also have almost 300 pharmacies that received vaccine as of last week. Some of them received relatively small doses of about 100 doses per store, but that will continue to be supplied and potentially increase as the nation's vaccine supply increases as well. Here is our vaccine webpage. We are still working on adding the percent utilized and the rate per 100,000 people to that top bar on our vaccine dashboard. We're hoping that that potentially can go live at the beginning of next week, with the zip code data potentially going live mid to end of next week. So that's what we're striving for with the dashboard. We continue to look at additional information to see how that can be added. And again, looking at our percent utilized, you can see that many of our counties are doing very well in getting the vaccine that they have into the arms of Arizonans. The one thing that we will note is when you see that it's above 100%, what that means is the federal allocations that go to the long-term care pharmacy partnership program, that go to the retail pharmacy partnership program, do not come through as doses ordered by Arizona. They are directly allocated from our federal partners to those entities. The same with any IHS facilities or the Veterans Administration, those federal entities that are getting additional doses. While they don't show up in our ordered column, they do show up in our administered column for the most part, except for some of the federal entities. So that's why you may see that there are more doses that have been administered than actually ordered. One of the questions we get is how to find a vaccination site. So I wanted to walk you through. Many of you have seen our Find Vaccine website with the interactive map. It does display a large number of locations that are open to the public, including, the eligible priority populations. It's going to tell you the type of vaccine offer. It actually has links if they are not using the state's registration site. It is not a requirement. And so if you're going to a pharmacy or a hospital or physician's office, they may use their own electronic health record or scheduling program, and I'll show you how to do that. And then it's also got the hours of operation and contact information. So again, not all vaccination appointments are scheduled through podvaccine.azdhs.gov. Anybody is welcome to use that registration system for free, but like I said, a lot of people, and I'm going to walk you through an example. So say you wanted to find a pharmacy in the Levine area. And so you can go to the map, you can pick it you can scroll into the map to get closer and get cross streets, or you can put in your zip code and it will come up with a list of those pharmacies that are those locations that are very close. When you identify a location, you can see that in this example, we've selected a pharmacy in the Levine area. You can see how the pop-up window comes up with the information it provides. Under the site details, if there is a registration link or a link to a website, we will link to that. If you click on that registration site, say for this one, this is a Walgreens location, it will take you directly to the Walgreens website, where you can see there's a button that says Find COVID-19 Information. If you click on that button with the red Band-Aid, it will take you to the COVID-19 vaccine webpage, which then you can either sign up to get additional information, or you can identify if there are any appointments available. And so that's consistent with how many of those sites are working. If it does go through the state pod, it will, or if you've picked a state pod, it will take you to the state sites registration, which is the pod vaccine at azdhs.gov. And then that will give you all of the providers that are offering appointments and registration information through our vaccine management system. You can always call our helpline at 1-844-542-8201, and that will connect you with somebody that can assist with scheduling. Again, that number is only going to be able to schedule appointments at sites that are at facilities or sites that are utilizing the Arizona vaccine management system. So they won't be able to help walk through a Walgreens or a Fry's Pharmacy registration. And with that, I will take any questions.
Okay, first up is Cameron from Channel 15.
Hi, Cameron.
Hi, Dr. Chris. Thanks for taking people through that. Wanted to chat with you about weather delays first and foremost. How can you explain the type of communication you're having with the smaller counties who count on that Moderna vaccine to run their vaccination sites? We know a number of those counties are having to postpone appointments, postpone events, now totaling in thousands of appointments, unfortunately for them. How are you staying in communication with them on when those doses will be fulfilled? Kind of explain how you're working with them, and then explain why Moderna tends to affect those counties versus Maricopa, Pima, and obviously the state-run sites.
Yeah, absolutely. So my immunizations team has been in contact with the rural counties as well as the Health Emergency Operations Center. As we get additional information from our federal partners, they've been having calls and updates. We've been providing that, and then the counties have been notifying us as they've needed to cancel or reschedule appointments. And so we've been working very closely with them to make sure that we know when they are needing to do that. The reason that it's impacting more so our rural counties is the Pfizer vaccine has some very, very stringent storage criteria. And so we have primarily allocated Pfizer to Pima and Maricopa County because those mass vaccination sites and our hospitals have the systems and the available storage to be able to administer the Pfizer vaccine. And we've saved our Moderna vaccine primarily for the rural counties as well as smaller providers in Maricopa and Pima County. And so as Moderna is being impacted by the weather, they're just not receiving those shipments, and that is delaying appointments.
My next question would be, as we move eventually into the next phase of group, so you're going to have to decide whether you want to do essential workers or those with underlying health conditions. How do you weigh that decision? Obviously, there's going to be a lot of overlap with both of those groups. I know essential workers want to be vaccinated. However,
Yes.
Obviously, based on what we know about this disease, it's those with the underlying health conditions that stand to have the greatest risk. How will you weigh out who will go first in those two groups? Because you probably won't do both at the same time because that will be too big.
Well, so likely what we're going to do is we will probably open it up when the Vaccine and Antiviral Prioritization Advisory Committee makes a recommendation to move into 1B. Based on that, we will discuss the specific numbers of each of those populations, but you are 100% right. These populations are not mutually exclusive. So we will be likely opening it up to essential workers as well as adults with high-risk conditions that are living in congregate settings first, which would be like our Department of Corrections, as they've got individuals who have high-risk medical conditions that put them at higher risk, starting to get those individuals vaccinated.
Thank you.
You're welcome. Thanks, Cameron.
Next is Josh Sanders, 12 News.
Hi, Josh. Thanks for making the trip down to Tucson yesterday.
I was just about to say I really enjoyed your alma mater. What a beautiful campus.
Oh, and the day was beautiful, wasn't it?
It really was. I'd like to think if I grew up in Arizona, I would have been a wildcat as well.
Oh, you can't say that up here. Don't say that up here.
Hey,
Sorry.
Listen, I'm okay with that. I'll take it. Hey, a couple questions for you. How many doses of the Moderna vaccine were delayed because of the extreme weather? And when do you expect those Moderna vaccines to arrive?
I believe that it was all of the doses of last week that were delayed. I'm looking to take a look. So about 89,000 doses. We expect them to probably arrive. I haven't heard that anybody's gotten a notification of a weekend shipment, so we are thinking that they're going to arrive next week, about the same time as potentially next week's doses. So hopefully we'll have a lot more Moderna in the state next week and can get to some of those appointments that were canceled.
Great news about there being an increase with the retail pharmacy program next week. Can you talk a little bit more about that? How many pharmacies across the state should or will start vaccinating?
Yeah, absolutely. So last week they kicked off the retail pharmacy program with 1 million doses nationwide. And so they had a million additional Moderna doses that the federal government allocated to the retail pharmacies. I want to say it was about 280, give or take a few, of the pharmacies, their Fry's, Walgreens, Albertsons, Safeway, that received about 100 doses each last week. They're going to continue and give another million pro rata, just like they did last week, to those same pharmacies. But they've also identified 1 million additional doses of Pfizer that are going to go to CVS stores. We've been in contact with CVS, who let us know that they had those. And we don't know which stores in Arizona are necessarily going to receive those just yet, but as soon as we do, we will add them to the Find Vaccine tracker.
And testing is down. We are seeing a decrease in testing across the state. Why do you think that is? And should Arizonans continue to get tested even though we are vaccinated?
Yeah, so we do notice that when the testing kind of follows the demand and kind of our peak. So as we're seeing more cases, a lot more people are seeking testing. And as we tend to go down in cases, people tend to drop off for testing. We would recommend that anybody who thinks that they've been infected with or exposed to COVID-19 still get tested. We know that asymptomatic spread can happen. If you come down with symptoms, we are aware, no vaccine is 100% effective. That's why we, in addition to getting people vaccinated to reduce severity and length of symptoms and all of that, that's why we work so hard to get the community vaccinated, because the less people that can be impacted by the disease, the better it is for those people that can't get vaccine or who the vaccine didn't work in. And so we would, if you've got symptoms that are consistent, even if you've been vaccinated, go get tested to make sure, because you don't want to spread it to people who haven't been vaccinated yet. I believe it's still very rare that a vaccinated person comes down with symptomatic COVID, but there are cases that have been identified in the nation. And so just to kind of keep that in perspective, what it is going to do, just like influenza, you can get your influenza vaccine. It may not prevent you from getting the flu, but it's going to reduce your severity. It's going to reduce the length that you can transmit it to others. It also significantly reduces your chances of hospitalization and death.
Thank you, Doctor.
Next is Howard Fisher.
Hi, Howie.
Got to unmute.
Oh, you have to unmute.
There we go. Good. Well, hi, happy Friday. Let me start off with where we just left off, which is the issue of getting people vaccinated. What is your latest projection of how many Arizonans will get vaccinated, and how does that compare with your feeling of what we need for herd immunity?
I think I'm very appreciative of the Arizonans that have gotten vaccinated. I am really pleased that we have such high demand for the vaccine. Initially last year, we were a little bit worried. I was pleased when we heard early that 55%, even before the data came out, said that they would be willing to take it. It appears to continue getting higher. I'm hoping that we're able to reach that this summer and get to a 65-70% vaccination rate. Our demand has not dropped off just yet, so that's a promising sign, but I'd probably have a better perspective once we started getting into the general population.
But that raises the question, a lot of doctors I talk to say that herd immunity for this virus is probably going to be like it is for measles. It's going to need to be in the 90% range. I mean, are we destined to fail at this?
Well, I think, I don't know that I would call it destined to fail. We're looking somewhere to try and get a 70 to 80%, but you're right. For something as infectious as measles, you need a 94, 95% herd immunity in order to make sure that you're keeping those that are vulnerable to measles and can't get vaccinated protected around them. With flu, that, you know, those numbers are much lower. So I think it's just gonna depend on, you know, how many people we can get vaccinated and what this virus does in the future.
Sure. Let me turn to the other issue, which has to do, I saw that you're going to divide up some money.
Yeah.
What took so long? I mean, you know, you were down in Pima County. I'm sure you got an earful down there from the county administrator and those folks. I mean, the fact is that you've had this 400 some million dollars for a while, and in fact, your own head of epidemiology had sent an email saying the state would only be able to provide $1 million. I mean, what took so long? Did it take a threat of cutting off testing to finally get some action?
Oh goodness. You know, we've been working on getting budgets. It takes a while to come up with like what kind of formula you're going to get. We still are looking at how much we need here at the state to, you know, continue the ASU testing, the sequencing. That's a lot of money to budget for. But we did want to make sure that those testing activities continued. And so that's why we're trying to get out that money immediately so that they've got that sustainable money, but there will be continuing money in the future.
And I looked at the numbers that were sent out with Steve's press release.
Yeah.
How is the money divided? Is it a population? I don't know that it seems to reflect population, but you know, how did you divide that money that you just gave out?
Yeah, so what they'll do is they'll start with what we call a base. And so that base can be, it's a specific set of money that all 15 counties get. And we look at that based on what are they going to need to be able to do that activity. And so in this case, it's $100,000 goes to every single county as a base. And then the rest of that funding is broken up on a percentage population. So I think Pima County is going to get like 14.3 million, but that's the formula that we settled on to get that first $100 million out.
Okay, and when can they expect something more? I mean, obviously, as I mentioned, and as my colleagues in Tucson have mentioned, Pima County is feeling a little hurt, a little ignored south of Gila there. So when can we expect more?
So, you know, that budget it has to be turned into CDC by mid-March. Obviously, we don't want to take that long to get it done. What we're looking at is, you know, every county has their wish list and what they want to be able to do based on their activities. Obviously, it's not, you know, the state can't fund 100% of all testing for every Arizonan. So we have developed the strategy of providing the ASU saliva-based testing around the state, working to provide long-term care facilities with rapid testing, sequencing on a statewide basis, and then working with the counties on their special projects. So Pima County, I believe, submitted a request for $40 million. That's what they said would carry them through their desired testing activities through August. So we'll be reviewing that and including, you know, those activities that don't double what we're already doing. We'll be including funding for that probably before mid-March.
Just one other quick thing.
Yeah.
I know, for example, for a while I was getting tested at one of the state sites, and kill that. And now I'm getting tested at Embry Women's Health, and they asked my insurance information, but the state never did. Why is the state simply saying, hey, you show up, we'll pay for it out of the state, as opposed to using my United Healthcare? I mean, it seems like there's money to be had out there, but the state isn't going after it.
Right. So we've partnered with some partners, just like you said. Like, so Embry Women's Health does look at the health insurance, and in order to be eligible for like public assistance reimbursement, that's one of the strategies. Back in the summer, when we were, you know, trying to expand testing and working with partners, we wanted a barrier-free way for Arizonans who needed to get testing to get tested. And so that was one of the things we set up with ASU's saliva-based testing, was the state pays for a certain number of tests. They don't need to collect health insurance. They just administer the tests and then give the results. And so we've continued that partnership to make sure that there is barrier-free testing, but also realizing that the healthcare system is providing testing as well.
Thanks a lot.
Thanks, Howie.
Okay, next is Max Gordon.
Hi, Max.
Hey, how's it going?
Good, how are you?
Great. So my question for you is a two-parter to start off. When do we anticipate we move into the next group eligible for vaccinations? And do the weather delays that we've seen over the past week push back the timeline for moving into the next eligible group?
Yeah, so that's a great question. And the weather delays may actually play a role. We had been estimating moving into phase 1B on a statewide basis, keeping in mind some counties may not be ready to do that beginning mid to March. And so hopefully we'll be able to go back and vaccinate all those people that we have to reschedule or had to cancel those appointments throughout the state, and can stay on track. But right now we're administering 250 to 300,000 doses per week. And so that's a pretty good progression. So hopefully we can still stay on track for that.
And we talked about delays because of the weather with the Moderna vaccine. Have there been weather delays with the Pfizer vaccine reaching Arizona?
So there were weather delays with Pfizer vaccine. Normally, like at our state pods, we receive the Pfizer vaccine either Monday or if it's a holiday on Tuesday. This week, I believe we got it either yesterday or today. We do have it, but it did delay it by several days. Luckily, with the way the pods operate, we were able to shift Pfizer around to make sure that the operations at those facilities were not impacted.
Got it. Yeah, that was going to be my question. Does it seem like you guys are having delays at state facilities for vaccinations, or does it seem like you've been able to handle the weather delays okay?
Yeah, we've been able to handle the weather delays okay at the state and county operated pods. We've been able to cover all of the appointments.
That's it for me. Thanks.
Thanks.
Next is Peter Seymour.
Hi, Peter.
Hello, Dr. Chris. Good afternoon. So real quick, touching up on the testing, the $100 million now available, can you also address if it's going to pay for tests, will it pay for staffing, or how's it supposed to be spent?
Yeah, absolutely. So that's one of the things that we're trying to figure out, but you're exactly right. That can go to a number of different activities, whether it's staffing, it's actually paying for the testing, it's laboratory capacity, it's electronic reporting, so informatics and that type of thing. It can go to any number of those strategies. So it will likely here at the state level, we'll use whatever portion we retain to do probably all of those activities. So to make sure that we're offering testing, that we are, partnering with providers to make sure that they have capacity, that we've got, additional resources for people to onboard so they can report those labs electronically. Each of the counties will actually get to utilize that funding that they receive specific to what they need in their jurisdiction. So Pima County, if they want to use it to continue to pay for the tests in their jurisdiction, they absolutely are able to do that. If they wanted to do it for public health staffing or informatics work, they could do that too. And they just submit the plan, and as long as it meets the requirements of the federal grant, the department usually approves it and allows them to do that activity.
Very well. Back to the pharmacies again. So we know that the federal pharmacy partnership, does the state have any hand in this? And as far as distributing vaccines, how else will be managed locally, and what guidelines have to be followed, federal, state, or county?
Yeah, absolutely. So that's a really great question, and it does get a little confusing when you look at our pharmacy partners. So for a while, we have already been allocating to some pharmacies that were willing to provide vaccine, or we're willing to take vaccine and work with our county health partners to do like school-based pods for vaccination sites. So they have been receiving state and county allocations. Last week, they started receiving that federal allocation. What our pharmacy partners do is they follow the state's guidance for that. The CDC makes, like, we have to fill out a form that says we're vaccinating healthcare workers and teachers and childcare and law enforcement and over 65. And then they send that out to the pharmacies that are participating in that. So it's a little bit of both that are going on, but the primary supply moving forward is going to be that federal allocation.
How many pharmacies are on board in the state of Arizona, regardless of where they're getting their doses? How many more to come? Any numbers there?
I know that we've got over 800 eligible, so are either onboarded with us or onboarded with the federal partners. I think there were 280 or so that were participating in the retail pharmacy program last week, but let me have Steve follow up with the total number of pharmacies that are receiving vaccine.
Sounds good. All set. Thank you.
Thank you.
Great. Next is Katie Davis-Young.
Hi, Katie.
Hi there. I know the big state pods are all booked through February, but March is just less than 10 days away. So any word on when March appointments will open up?
Yeah, so as we get a good view after the weather delays and stuff, and we're able to get a good view of what we believe the next few weeks of vaccine allocation include for our Pfizer doses, we will be opening up appointments for March. And so we're just trying to figure out, we want to make sure that we can cover all of the appointments that have already been scheduled, in addition to ensuring that anything that we will schedule in the future, we can also cover. So we've just got to do that math when we see that final allocation.
Did you have a follow-up?
That's it.
Okay, thank you.
Thank you.
Bailey Miller.
Hi.
Hey, Dr. Chris, thank you. So I've been talking to doctors and they're a little bit worried. I know you mentioned this a little bit earlier, just about the testing and how it's been happening less and less over the last several weeks when there's not a surge. And I spoke with doctors. They're a little bit worried about this because then we're not getting the proper numbers on how many people actually have COVID, of course. So what more needs to be done to get more tests, and how can we fix this problem?
Yeah, I would just encourage anybody who believes that they've been exposed to or infected with COVID to go get testing. We still have the same amount of capacity that we did back in, November, December, and January. It's just going to be people now seeking out that testing. So again, especially even if you've been vaccinated, but you believe that you've got symptoms, it's always good to rule out, especially if you're going to go be with people that you don't live with, to make sure. And so we would just encourage anybody, if you feel you need a test, there is adequate supply out there.
Okay, perfect. And then one more question. Obviously, with the delays with vaccine, are you worried at all of how much this sets us back? Of course, it does set us back, but does that worry you?
I think we've got really good demand, and so I think there are places that have the capacity but haven't had the supply to, get up to that capacity. That's going to be less in our rural counties, and so trying to catch up may take a little bit, but overall, I'm not concerned because they should have that vaccine at the beginning of next week.
Perfect. Thank you.
Stephanie Ennis.
Hi, Stephanie.
Hi, Dr. Christ. Thanks for taking our questions. When I looked at the state vaccine plan, it looked like the healthcare worker population was around 255,000. And I wondered if you had any sort of sense of what percentage of that population has been vaccinated, and if that's data the state is going to be able to share.
So I don't have those numbers right off the top of my head. And what we've required individuals to report who are administering the vaccine is really the phase that they're in, not so much the occupation. If they've registered through the vaccine management system, we do have screening questions that can identify if they're a teacher, if they're over 65. Again, people can answer multiple questions, like you can be a teacher who is over 65, but I've asked the team to kind of get percentages out of that using the highest priority. If you're a phase 1A healthcare worker, that trumps over the phase, 1B 65 and older, to start looking at that data. So once we have that data, we can get it to you.
And I guess you don't have any sense at this point whether most healthcare workers got the vaccine. Is it too early to say?
I'd have to go back and look at that vaccine. I think that the counties felt like they had gotten a pretty good percentage of the healthcare workers when we moved into phase 1B, but I don't know what those percentages are off the top of my head.
Okay, good. Thank you.
You're welcome.
Next is Dylan Rosenblatt.
Hi, Dylan.
Hi, Dr. Christ. So just kind of going back to a little bit what how I was asking you about over reaching herd immunity. Based on the polling numbers you gave last week, and I know the governor's office has talked a little bit about it to some other media, what more done to get those numbers of people who want to receive the vaccine higher, and how much comes into play with supply not meeting demand right now?
So that is a very great question, because there's a lot of strategy that's involved. So right now, you're right. We have supply that doesn't meet demand, and that's actually what phase 1 is when you've got less vaccine than people want it. As we move into phase 2, that's going to be that the supply meets the demand, and that's when the general population will have access to that vaccine. And the communication strategies are different for that. So really addressing that, the importance of getting vaccine, helping the community. As we move into phase 3 is when supply exceeds demand. So now we've got plenty of vaccine out there, and we still have people that don't want to get vaccinated. And so really tailoring the communication strategy and encouraging, talking specifically to what the fears are, what the hesitancy is, working with vaccine hesitant groups to, talk them through, provide information, get trusted leaders to talk to those populations, as well as, encouraging healthcare providers that when they're addressing this with their patients, to get vaccinated. So we'll continue. You'll see the messaging start to shift and start to become more targeted at that time, just like you'll see more messaging about communication as vaccine becomes more plentiful. Because right now it's just frustrating if we run a vaccine, like roll up your sleeve campaign, go get your COVID vaccine, and people really want to, but you can't find it. So we're basing that communication strategy on what phase we're in.
So when will we see this kind of shift in communication? And is that going to be like along the lines of the Mask Up Arizona campaign that started over the summer?
So it'll be more along the lines of the roll up your sleeve campaign that we did for influenza. So really trying to, encourage people to get vaccinated, that you're helping not only yourself, you're helping your loved ones, you're doing it for the healthcare system. And getting messaging out to that, and then tailoring some of that messaging specifically to communications. Some of that has started. So we've started targeting at-risk like zip codes. And so really tailoring the messaging, because we do know that we have vaccine hesitant or vaccine fearful communities that we still want their over 65 and their protective services, workers that are in those communities to get vaccinated. So we've started trying to get some of that communication out there without overwhelming the general population with, oh, you want vaccine? Well, right now you can't get it. And making sure that we're balancing that.
So then targeting those groups, how much what type of responses have you seen, given that opening up pods, especially down in Pima County, is taking away from those communities for whatever reason they're not able to travel the distance to be able to get their vaccines yet?
Yeah, so just to clarify, with the pod that we opened up at U of A, that was determined to stay a Pfizer pod, so it's actually not taking away from those other communities that were being used for Moderna. So we had been thinking that the Moderna supply was going to increase, and that didn't happen, so we shifted U of A back to Pfizer. So that should not impact rural communities or community-based settings. One of the cool things about the U of A, the reason we chose it was because of its central location and its, being a university and being tied into public transportation. They actually put a walk-up clinic, so people don't need to drive through, they don't need to have cars, they can walk through that clinic and get vaccinated. And so that was one of the features that we really liked about the University of Arizona, was that dual ability to do that.
Okay, thank you.
You're welcome.
Okay, next I'm going to call on Avery, and then I'll get to Peter Samore. Oh, hold on. My mistake. This should be Avery.
Hi.
Hi there.
Hi.
Thank you for taking our questions. I just wanted to touch a little bit on what we spoke about earlier. Pima County officials said the county has spent more than $40 million in relation to COVID-19 testing, but the state said it could only reimburse $1 million at this time. So why can the state only reimburse $1 million?
I think that the county's a little bit confused on a couple of points. The funding that is coming available cannot be used for reimbursement. And so that was a strategy that Pima County decided they wanted to provide free testing to all of the providers, which, like Howie pointed out, that's a little bit different than what we normally see with healthcare testing. And so that was a decision that they made, and I think that they had and utilized CARES Act funding for that earlier on. So the grant funding that we have that's federally funding, this $100 million, can only go to fund activities from January 15th on. What my team was trying to do was, as they were saying that they thought that they were going to have to shut down those services, was to quickly get $1 million out of other funding that could go to support their partner, their testing partner, which is Paradigm Labs, to keep them going until they get this funding, because it does require contract amendments and those types of things. So they just wanted to be able to provide that $1 million. So it wasn't really a reimbursement, it was to continue testing activities.
Okay, thank you. So there isn't going to be like a next reimbursement payment?
No, so there's not reimbursement. It will be a moving forward funding opportunity.
Alrighty, thank you so much.
Thanks.
Okay, and we have a double dose of Peter Samore. He's back.
Hi, Peter. You're back.
Double dose of me, but it does nothing for the coronavirus, let me tell you. So sorry, bad joke. Who is eligible to get vaccines at pharmacies participating in either state or federal programs? Do they still have to follow the priority group guidelines, or are they geared maybe only for the older folk, something like that?
Yeah, so they're supposed to be following the same phases and guidelines that the state is using right now. So they will be, you can be a healthcare worker, you can be a long-term care facility worker, you can be a protective services, childcare or educator, or over the age of 65. And we have the ability to update that as we move through the phases. So as those phases continue to move, we'll be adding in then essential workers and what in Arizona essential workers means. And so we can continuously update them.
Thank you for that, allowing the follow-up question.
Yeah.
Great. And next is Lorraine Longy.
Hi.
Good afternoon, Dr. Christ. Hi, just a quick follow-up to, I believe, an answer that you had made a few minutes ago, but earlier this month at the opening of the Phoenix Municipal Stadium site, you had said that the vaccine would be available to other essential workers in the 1B category, grocery store workers, et cetera, by the end of the month. I think you had just said a few minutes ago that would be now around mid-March. Is that correct?
Yeah, so some of our counties have moved into that essential worker phase. So Gila County is actually in 1C. They've moved forward to the 1C population. We're looking, end of month beginning, and probably having other counties follow. I know Maricopa and Pima just moved to the 65 to include 65 and older, so they may be a little bit behind. But this is something that we're going to be discussing with our VAPAC committee on Monday, is, when to transition into 1B.
Okay, perfect. Thank you.
Yeah.
Okay, and returning with another question is Howard Fisher.
Hi, Howie.
And I thought I would today. I just want to make sure, because something you just said to one of my colleagues surprised me. So basically, Pima County did some testing, which was all being encouraged, but basically anything that they spent prior to January 15th, they're just out of luck.
So they did get CARES Act funding to support some of those activities. I know that we gave them a little bit of testing funding, and we've been trying, I know we've been paying for like the airport testing since January 1st and those types of activities, but this federal money is not, it's for activities from January and 15th on, my group tells me. It is not for reimbursing previous activities.
Even though the administrators said they were under the impression that some of the 10.7 million that they spent out of the county funds was going to come from you. So where did the communication break down here?
Oh goodness, I would have to go back, Howie. I don't remember us agreeing to that, but I'll take a look.
Okay, well, it's always fun to watch Pima County fight with the world.
We're not fighting with Pima County. We're giving them money.
Okay.
Okay, I'm sure that they appreciate that. I'll tell Chuck when I call.
Okay, it's 1:50, and believe it or not, we are out of questions. Thank you, everyone, and thank you to
you.
Dr. Christ. Have a great day.
Have a good day.